So in this video, we're going to look at starting an IV. Now, this is one of the most coveted skills for nursing students during clinicals. It's one of those things that you're going to be able to brag about being able to do on the first try. The more you practice, the better you'll get at it. So the other thing to know is it's really hard to actually teach you how to do this virtually. So what we're going to do is show you what the whole process looks like, but really you've got to get in there, get your hands on a patient, and physically practice this. So the first thing you need to do once you've gathered all your supplies is look for a good vein. Now, we try not to go into the AC unless it's an emergency because that's where they flex their elbow. So I usually start in the distal aspect of the patient's non-dominant side if possible. So grab your tourniquet, place it about 6 to 8 inches above where you're wanting to look. That should plump up the veins nicely. When you see one you like, give it a little press, make sure it's nice and bouncy, there aren't any valves, it's not hard and firm. My biggest rule of thumb is you go for what you can feel, not just what you can see. Your eyes will play tricks on you. So once you found a good spot, remove the tourniquet while you get the rest of your supplies ready. Open up your dressing, open up your saline lock and your syringe. Connect the syringe to the saline lock and prime it with saline. You also might need to loosen the cap at the end of the saline lock because they can be really tight, but just don't take it off all the way because you want to make sure you keep it covered. So again, make sure you prime it completely with saline. And then you can start prepping the rest of your supplies. Get out your angiocath, put your dressing where you can reach it. And then you want to grab your roll of tape and pull a small piece of tape off and put it on the table or the side rail, somewhere you can reach it really easily. So before you get started, make sure all of your supplies are within easy reach with one hand. Do not leave them behind you, okay? So now that you're ready to go, you can go ahead and replace your tourniquet about 6 to 8 inches above your insertion site. Palpate again to make sure that the vein is still there, and then use your antiseptic swab to scrub the site clean. So you're going to want to clean in concentric circles, starting in the middle and working your way out. Now, it's important here to know if you're going to draw blood cultures off of this IV start, you need to scrub for a full minute with chlorhexidine. So now you can grab your angiocath. In this case, we chose a 20 gauge needle. So once you get it out of the package, take the cap off, and then you want to inspect the catheter. Make sure it's not damaged or kinked in any way. If it is damaged, take the tourniquet off and go get another one, okay? So if you're good to go, you're going to use your non-dominant hand to stabilize the vein below where you're going to insert. Make sure the bevel is up on your angiocath. Usually there's a little plastic piece at the top you can use to guide you. Hold the needle about 15 degrees to the skin. Any steeper, you're going to go right through it, shallower, and you'll miss it. You want to insert firmly, but not too fast. That's the part that becomes muscle memory. Once you're in, you'll see a flash in the chamber. So here's where you need to hold the needle still and advance just the catheter. Now, some needles allow you to do this with one finger, but if it won't, you can use your opposite hand. Use your non-dominant ring finger to put pressure on the vein about 1.5 inches above the insertion site and pull the needle out, activate the safety device. Grab your saline lock, twist it onto the hub of the catheter, and make sure you're continuing to hold that catheter still. You want to gently pull back, make sure you get blood return, and then flush about 5 mils of saline. If you're good to go, keep one hand on the catheter and release the tourniquet with the other. Then you can grab that piece of tape that you pulled off and put it straight over the hub to secure it temporarily. Now, grab your dressing. So put that dressing firmly over, completely over the insertion site so that it's covered and prevented from infection. And a lot of these dressings will actually come with an extra piece of tape that you can use to secure your saline lock loop. So make sure that you do that as well, or you can just grab another piece of tape to do that. Once your dressing is on, you can write the time, date, and initials on your dressing. Now, throw your sharps in the sharps container, throw the rest of your trash away, and document your new IV. Great job, guys. So truly, this is a task that will get better and better the more that you do it. And even if it's your first time, man, go in with confidence and be awesome at this. And also, don't be too hard on yourself. There's times when me as a nurse for 10 years, sometimes I just can't get an IV, and that's okay. Just keep practicing and make sure you keep your confidence level up. All right, guys, we love you. Go out and be your best selves today. And as always, happy nursing.